are there any medications to help ME/CFS?
Oh, there's a, I'm just laughing because there's a ton of medicines that help symptoms of ME/CFS. Okay. When it comes to ME/CFS itself, I don't think it's a thing. Okay. It's a collection of symptoms.
And a collection of causes.
Yeah. And it's, how do you say, like, in medicine, when you have something that gives you like a definitive broken piece, that's a disease we can all agree on. But when many illnesses are collections of symptoms, okay, I mean, even things like, Parkinson's is a good example. I mean, Parkinson's is not one disease. There's lots of different things. And half the people with Parkinson's have atypical Parkinson's, according to the neurologist, where they don't quite fit every criteria, but they definitely have, enough of it. They have a movement disorder and some other things going along with it. The point is, like, when you have a pneumonia, you have a chest X-ray we all agree on, and it's kind of clear. Okay, so and that's usually caused by a handful of bacteria, usually, or viruses that we can define. So there's a cause and an effect, and they're pretty close together usually in time. Okay, but when it comes to syndromes, things like chronic fatigue, and Parkinson's, and a lot of the other illnesses, there are endpoints, symptoms at the end that all are similar, but you got there for many different reasons. Okay, so the great dilemma, there's literally 30, 50 medicines that doctors use, for people with chronic fatigue for different symptoms. And they all work sometimes in some people really well for some of the symptoms. There are cerebral vasodilators that in some people helps their cognitive function. I mean, just like we see for cognitive function, there's an ADD medicine, guanfacine, which affects the sympathetic nervous system in your brain. And for some people with ME/CFS and people with COVID, with long COVID, that, plus some antioxidants really help brain fog. Okay, but it doesn't work for everyone. It just works for some people, depending on how you got there. And, there are vasodilators that sometimes work for brain fog for some people. So there are lots of medicines that help the symptoms of POTS and orthostatic hypotension. There are lots of things that will help your reflux or your sleep disorders, and your muscle pains. We usually have to go to deeper things than just medicines, because that unfortunately muscle pains usually have to do with more complex things like the blood flow issues that we were talking about. And with ME/CFS, again, there is a subset that do respond to mild doses of blood thinners or platelet modulators.
Right. So I think what you're also saying is that there's ways to treat it symptom by symptom according to your body, but at the same time we have to uncover why this is going on. So all these great medications that you listed for symptoms are fantastic band-aids to allow you to feel well while we're searching for and treating the root causes and modulating the immune system, because sometimes we can take the root cause away, remove it, but the immune system is still in disarray. So
yeah, and still stuck in inflammation. I think that's what's so frustrating, is because, again, like I said, with pneumonia, there are herbs or there's antibiotics. And if it's acute pneumonia and it's bacterial, the antibiotics are kind of magical. And that's what we grew up on. That's what we're looking for. And when we're dealing with these messy, complex illnesses that are different in different people, I mean, that's what it keeps coming down to, and is so frustrating for the patient and the clinician, is looking, and just to address, I think, what Dr. Parpia pointed out that is so important is that so many of these treatments, when you look at these medications, they're going to deal with a symptom. But if we deal with enough symptoms, okay, we can sometimes find the root cause or treat the root cause, but actually sometimes we don't even have to be so good. We just have to treat enough symptoms that the body starts to feel safe, okay? You don't stop feeling sick all the time, and then healing actually can happen. I mean, it's, I know sick people can be really sick and tired of people telling them, oh, just relax and meditate and you will be healed, and that's very frustrating when you've been sick for 10 or even for a year and you get that. And, again, yeah, meditating and relaxing helps everything, but it's not enough. But at the same token, one of the secret of returning to health, once you removed the big triggers, is the body feeling safe again. And so the less pain you're in, the less, if every time you stand up, you get dizzy, if that goes away, your body feels a whole lot better. Okay, not necessarily, doesn't mean you're going to go out and run, but it means that you're not getting this big danger signal every time you stand up. And that's happening, autonomically. It's not about how you think about it. It's just about how your limbic system reacts to that very fearful thing of suddenly you're either dizzy or your heart's racing. I mean, that just yells danger. And that keeps your immune system upregulated, and it gets in the way of healing. So, to long story, that's why all these different medicines that aren't going to, or herbs or treatments, because there's a lot of treatment modalities that will also quiet some people's immune systems. I mean, just to mention them, like all the PMFs and the magnets and the electrical stim devices, in the right person, those can really help. But be careful, because there are people who have become so sensitized that even what should be a healing message from those devices can be too much and set you off. So if you are interested in those things and you are very sensitive, start very slowly.